Good morning, afternoon or evening to you. I'm Dr. Joanne Newbury from the University of Bristol in the UK, presenting findings from the ALSPAC cohort on the association of early life air and noise pollution exposure with mental health problems from childhood to young adulthood. Air pollution is a pervasive problem, with 9 out of 10 people breathing unsafe air. It negatively impacts our health and causes up to 7 million deaths each year. There is also a growing body of evidence associating air pollution with mental health problems, such as psychosis and depression. However, relatively few studies have examined the impact of early life exposure, including pregnancy exposure, despite infants being especially vulnerable. Additionally, few studies have examined the impact on youth mental health, despite youth being a critical period for incidence and intervention. And few longitudinal studies have explored the impact of noise pollution on mental health, despite the correlation between air and noise pollution. So we investigated these questions in the Avon longitudinal study of parents and children, or ALSPAC, which tracks over 14,000 babies born in the early 1990s in and around the city of Bristol in the UK. A geospatial linkage was performed to link high-resolution air and noise pollution data to residential addresses from pregnancy to age 12. Mental health problems, including psychotic experiences, such as hallucinations and delusions, depression and anxiety, were measured during interviews from ages 13 to 24. And in our analyses, we controlled for numerous potential confounders, including ethnicity, family psychiatric history, maternal social class, maternal education, housing tenure, and area level confounders, including neighbourhood deprivation, population density, green space, and social fragmentation. The air pollutants included nitrogen dioxide and fine particulate matter, and you can see in the graph that the levels of these pollutants gradually decreased over time, but remained well above the World Health Organization's thresholds for these pollutants. So over 9,000 participants had mental health data, of whom around a fifth had psychotic experiences and around a tenth had depression and anxiety between ages 13 and 24. And after controlling for all of the potential confounders that I mentioned, we found that participants who had been exposed to higher levels of fine particulate matter early in life went on to have more psychotic experiences, with interquartile range increases during pregnancy and childhood associated with an 11% and a 9% elevated odds, respectively. Likewise, those exposed to higher particulate matter in pregnancy had a 10% elevated odds for depression. In contrast, air pollution was not associated with anxiety, but noise pollution was. So participants exposed to higher noise pollution in childhood and adolescence had a 19% and a 22% elevated odds for anxiety, respectively. To summarise, early life air and noise pollution exposure are prospectively associated with 3 common mental health problems in youth. There may be some specificity in terms of pollutant, timing, outcome associations, and this is interesting as it could provide clues about underlying mechanisms. For air pollution, such mechanisms might include elevated inflammation and direct damage to neurodevelopment. For noise pollution, mechanisms could include disruption to sleep and overstimulation of the autonomic nervous system. If we assume a causal relationship, interventions to reduce air pollution might improve youth mental health. However, the findings from these studies are observational, and so causality remains uncertain. We now need quasi-experimental research on the topic, which is becoming increasingly possible due to the rollout of clean air zones in many parts of the UK. Lastly, to say a huge thank you to my co-authors, funders, and the ALSPAC families and team.